This discovery was accidental. Indeed, there is a saturated fat emerging as the first essential fatty acid to be discovered in over 90 years since omega-3. We're developing insulin resistance, chronic inflammation, fatty liver disease, high cholesterol, and even the full suite of changes consistent with Alzheimer's. Why some dolphins are aging healthier than others. What we found, we thought for sure it was going to be omega-3s, right? Because all they eat are fish. And instead we were surprised.
What is C15 doing exactly that is helping to prevent that?
Now we're seeing kids getting type 2 diabetes. They're aging faster than they should. And we think a big part of it is
How would you eat if you wanted to increase your levels?
the first cases were identified by Mayo Clinic in 1980, and now it's present in 1 in 3 people globally.
I just can't even imagine what that must feel like to have brought something like this to the world. You're going to save and improve the quality of so many lives. Hey everyone, today we have a really exciting show with someone I've been dying to meet and interview and share with you. It's Dr. Stephanie Venn-Watson. She is the CEO of Serafina Therapeutics. She's a veterinary epidemiologist who has discovered the first essential fatty acid in 90 years. This is a huge deal. And she's discovered it with dolphins. She's dismantling years of dietary dogma. And so I'm really excited to share with you her new longevity nutrient. So welcome to the show, Dr. Venn-Watson.
Autumn, great to be here. So excited for this conversation.
Me too. So tell me, go back to that moment when you started to realize that your research with dolphins was about to dismantle 50 years of dietary dogma. What was that like for you?
It was a really, and that really lasted for about 10 years. So a moment happened, right, where it's like, okay, we're working with dolphins. We're, as a veterinary epidemiologist, working with the Navy's marine mammal program to continually improve the health and welfare of dolphins. So this discovery was accidental. It was intended to help improve aging Navy dolphins, not people. And, we had realized that I'll cut to the chase, given your question, but when we had found that this C15, this odd chain saturated fat, in which our primary source of the saturated fat is from meat and from butter and from dairy products, as it not only not being bad, but predictive of healthier aging, long-lived, large-brain dolphins, we thought, what? So,
Yeah.
but we have allowed the science to play out. And now it's not just us, but over 100 peer-reviewed studies from independent groups around the world, all coming to the same totality of evidence contributing to this, of showing that indeed there is a saturated fat that is not only beneficial, but like you said, emerging as the first essential fatty acid to be discovered in over 90 years since omega-3. Big discovery, but it was like and then using the science to then be able to be like, oh no, really,
Yeah.
right?
I know. I'm so excited for you because in my research for my dissertation, that's what we learned. There were associations with longer chain saturated fatty acids, different than odd chain, but C15 is longer chain than some, that it would have a decreased risk of cardiovascular disease. And we're going to get into what exactly you found. But first, what do you think? Do you think there should still be this cap on saturated fatty acids at 10%? Do you think the evidence supports that cap?
I don't know about that yet.
Mm.
So because, our focus has been on C15, and C15 is present at such teeny tiny levels. So we're talking like, only like 100 to 300 milligrams per day, which is a tiny amount. We now know we need enough C15 in our diet in order to support these long-term health benefits. And Autumn, to your question, like back in the 1950s, we had, the average American drank 2 full whole fat cups of milk per day. Today, that's down to like a quarter cup. In many cases, low fat or non-fat milk has no C15. So, we do know that as we've decreased our intake of these whole fat products, that has been decreasing our C15 levels, which we do think has had a meaningful amount, so much so that it may be contributing to this an emerging, nutritional deficiency. So by saying we needed to decrease our intake of these foods with saturated fats, it has had a meaningful consequence that's really starting to play out in the literature.
Yeah. And I just want to remind people that we are just like in 1929, that's when we kind of discovered George and Mildred Burr that we needed essential fatty acid, linoleic acid. I'm such a nerd about this stuff, but and then we're still learning. And to say that all saturated fatty acids, this is such a diverse category, and to say that all of them should be avoided or eliminated, like you're saying, we don't need them in huge amounts, maybe, but some of them seem to be emerging as incredibly important nutrients. So do you have anything to say about that? On the fact that, I think it's the diversity of saturated fatty acids. I think it's the dietary context. I think there are so many things that we've just thrown by the wayside. Do you want to mention anything else about that on saturated fats and why you
Yeah,
think they've been wrongly demonized?
I mean, I think as far as like when we talk about there's like you said, there's so much diversity. It's like what types of foods are we talking about? Which saturated fats? What was the animal that we're eating? So we know that the more right, the
Yes.
more grass that cows or beef eat, the greater their C15 in their milk, in their meat. We know that like grass-fed Australian beef had some of the highest C15 content. And so as agriculture has changed, then that's had an impact on, our C15 levels. So even if you look at the same products, the same whole fat milk, that C15 levels have been changing just even because of agricultural practices of what we're feeding the cows.
Yeah, I love that. So it's that dietary dogma about the avoidance of saturated fat. It's the way we're feeding our animals. And then, of course, it's the dietary context all working against us here. So, Stephanie, Dr. Venn-Watson, take us through your research. Like, what were you doing with dolphins? Navy dolphins, I learned, live a lot longer and, which might surprise people, seem to be a suitable kind of alternative to rats to actually study human metabolism and maybe draw meaningful conclusions from them. So can you take us through just like what were you doing and what did you discover?
Sure. So I was recruited by the Navy. I'm going to date myself out of 28, 25, 24 years. Years ago. I was 10. Um,
You
so,
were 10? Okay. I'm with you.
uh, so was recruited by the Navy 24 years ago, and to their credit, they wanted to bring in a veterinary epidemiologist because they had accumulated. So the Navy has taken care of this sustained population of about 100 bottlenose dolphins for over 60 years,
Mm.
and so because they've been around for so long and they've received such good care, they'd accumulated a lot of data, a lot of samples, and they were increasingly seeing their dolphins get older and older. Just like you brought up, Navy dolphins, if you look at dolphins in the wild, they live to about 20. Dolphins at the Navy are routinely living into their 40s, 30s, 40s, 50s, and two dolphins this past year turned 60 years old.
Wow.
Isn't that amazing? So
So
they
cool.
get really good care. And so over a decade, we were able to then find that older Navy dolphins, about 1 in 3 of older Navy dolphins were developing insulin resistance, chronic inflammation, fatty liver disease, high cholesterol, and even the full suite of changes consistent with Alzheimer's.
Mm.
So as we were seeing this, it was really fascinating for us because my job then was to say, hey, Steph, figure out now that we have this accumulation of all these data from these dolphins throughout their lifetime, can you figure out why some dolphins are aging healthier than others? And then, most importantly, to come up with an intervention to get those poor aging dolphins to be healthy aging dolphins. This is what we have focused on in humans since the beginning of research. But we were gifted with this opportunity to help dolphins funded by the Office of Naval Research, again, to help the dolphins. This is a very clean population, right? We don't have different socioeconomic status. We don't have smoking. We don't have drink. Like, it's a super
Yeah.
clean patient population. And what we found was we were able to use this advanced technology called metabolomics, look at thousands of small molecules present in their archived serum, as well as in their all fish diet, to see which small molecules predicted the healthiest aging dolphins. So we were actually going over not what is causing them to be sick, but what is protecting them and keeping them healthy. And what we found, we thought for sure it was going to be omega-3s, right? Because all they eat are fish. And instead, we were surprised that the saturated fatty acid, C15, was the top predictor of healthy aging dolphins. When we gave them a fish diet higher in C15, their red blood cell membranes became stronger. We'll talk about mechanisms of action. We were able then to move C15, the dolphins got better. They had improved red blood cell health, improved liver, improved cholesterol health. So that then allowed us to move C15 into the lab and be able to really march through a very rigorous, series of studies to then end up in that core paper saying, wait, we think C15 is meeting the criteria of an essential fatty acid.
Yeah, that's really cool. So you initially took two populations of dolphins, right? One that was in the wild and one that was in the Navy. And obviously they were having slightly different diets, but the ones in Sarasota, right, they were healthier. Can you talk a little bit about that and just like a little bit flesh that out a little bit? I love that experiment.
Yeah. So the Sarasota dolphins, which were, initially going to call it the Sarasota dolphin diet, right? So for what they're eating.
Yeah.
But what we found was that so the Navy, we had almost three sets of dolphins to compare. The first was within the Navy population, because they were getting so old, we could compare healthy older dolphins versus less healthy older dolphins within the Navy and see the difference. And then, just like you're saying, we were then able to compare, okay, let's look at younger dolphins and look at their health and compare it between the Navy and Sarasota Bay, these wild dolphins. And what we found were the Sarasota Bay dolphins, when you look at the younger ages, when early signs, right, of these chronic aging associated conditions just start, showing up, that we were seeing that the Sarasota dolphins, exactly, lower risk of insulin resistance, lower risk of fatty liver disease. So that again gave us a big insight into, once we then also compared their fatty acid levels, and we were seeing the Sarasota dolphins had much higher C15 levels in their blood and as well as in their diet. So when all of this was happening, we started reaching out to experts in human health to help us with the dolphins, to be like, hey, we think we've made this, we're found this, this interesting, discovery. What do you think? And how can we help dolphins? And Autumn, the conversation completely turned around to, wait, what? Like, what? Like, wait, you have a long-lived, large-brain mammalian patient population that is naturally getting these diseases that we've spent our careers on, and you're finding a way, not only do they develop these diseases, but you're finding ways to help mitigate it. It became a symbiotic relationship with the human research community, in which it's great to help the dolphins, but all of a sudden it became a huge unlock for human health. Then at that point.
So cool. And I want to talk about the fish. What were the fish that the dolphins were eating that were higher in C15 and C17? So we know
Right.
what we should be eating. What were they?
Exactly.
Yeah.
So in the up until the late 1990s, the Navy dolphins had often been fed a super fatty fish called Eulachon fish.
Mm.
And they are so fatty that you could dry the fish out, stick a wick in it, and light it. And so it was like they were called candlefish because
Mm.
they had so much fat content in them, including C15. Now we're learning. In the late 1990s, that fishery died out. And so the Navy then had to transition the fish that were being fed to the dolphins, and it really then became divided out over 5 different types of fish.
Mm.
And it ends up that 2 of those types had no C15 in them. And the
Ah.
other, so that's why we had some dolphins at the Navy were getting diets higher in low C15 fish. Other dolphins were getting diets higher in C15. And then all of a sudden we had naturally created, differences in diet, which is so crazy, thinking of different types of fish, right,
Right.
has
Yeah.
an impact on whether you're a healthy or non-healthy ager. Crazy, right? So what we found was that, so obviously the Eulachon, but those, those have been fished out.
Yeah.
So mullet. So then we went to we went to the Gulf of Mexico to say, what are the Sarasota dolphins eating? And that's where they eat mullet and pinfish. So again, not things that we get. You go to your local restaurant or grocery store, you're not gonna probably, unless you're at the Gulf, if you live along the Gulf, mullet is, you can actually find it there. So we found that mullet and pinfish, so when we gave the dolphins a diet higher in mullet and pinfish, which had higher C15, that's where we saw this improvement, including complete alleviation of chronic anemia of aging. So really strong results. For us, if you look at like USDA data reporting C15 levels, salmon has C15, and then anything that has, unfortunately for us, good for the dolphins. Highest C15 levels are in the skin and the heads of the fish. So, if you talk about, like sardines, anchovies, where
Mm.
you're eating the whole fish is kind of your best bet.
That's amazing because it's interesting because I've been doing all these really nerdy deep dive podcasts into glycine too, which comes in fish heads and fish skin. And so we're just over and over learning that the way that we're eating animals today, it needs to change. We need to go back. And so that's fascinating. So can you talk a little bit about the mechanism? Like dolphins are getting insulin resistance. That's crazy. So what is C15 doing exactly that is helping to prevent that? And anything else you saw? I know insulin resistance, type 2 diabetes, metabolic syndrome, fatty liver. Just tell us what C15 is doing for the animals first.
So what we found was that and it was really, this is probably, gosh, Adam, probably a decade's worth of work of diving in, literally going in, reading paper reports from pathologists about what dolphin livers look like and what they, over time when they passed away and they did the full workup on the dolphins. So what we elucidated and what dolphins, right, the huge unlock they gave to us was they showed that if they don't have C15 levels that are high enough, so one of C15's primary roles is to strengthen our cell membranes. And so I know you're going to be having a good discussion about that
Yes.
soon.
Yes, with Andy
um,
Hilbert. Yes, tonight.
yeah, so exciting. And so it plays a core role. It's a sturdy fatty acid. It has no double bonds. And it's one of its roles is to strengthen our cell membranes against lipid peroxidation and breakdown. So lipid peroxidation, if you had to choose one thing that drives and accelerates our aging, for me, everyone has their own favorite, but in the longevity world, but mine is lipid peroxidation. So C15 protects against that. Where this became important in the dolphins is that if they didn't have enough C15 in their red blood cell membranes, right, then their red blood cells became fragile. We saw this present in the dolphins as, chronic anemia, but we also saw lower hemoglobin and higher amounts of what's called red blood cell distribution width.
Mhm.
RDW is now becoming a super popular science-backed biomarker of biological aging rates. So that's a whole nother discussion. But so we found that low C15 equals more fragile red blood cells. As these red blood cells became more fragile, they were then engulfed by cells in the liver called Kupffer cells. And their whole job, not their whole job, but one of their big jobs is in the liver is to sit and wait for fragile red blood cells, take them out of our system, recirculate the iron, and put the iron back into play. It works great until you have a whole lot of fragile red blood cells. So
Mm.
lots of fragile red blood cells, Kupffer cells engulf all of these cells. And what happens then is iron overload. So the iron gets overloaded in the liver. That then sets up the perfect scenario for what's called ferroptosis, which is a whole new form of cell death that was discovered by researchers at Columbia University. We didn't know it at the time, Autumn, but this
Mm.
is exactly what the dolphins were teaching us. So then they have iron overload in the liver that then spills out up and over into throughout the body and accelerates aging where iron gets deposited throughout the body. This then results so it happens in the liver, in the pancreas, in the heart, in the brain, and that results in insulin resistance and fatty liver disease that progresses to non-alcoholic steatohepatitis, which is now called MASH, just going under rebranding right now, um, and and all of these downstream things we were seeing of accelerated aging. So when we put C15 back into their bodies, then we saw all of this reverse. The red blood cells strengthened. We started seeing insulin resistance go away. More importantly, there have been two experimental models in the lab in which this has been proven out in a much more controlled setting, one by us, but importantly, one by a second completely independent team in France who has shown that there's a specific pathophysiology of low C15, what it causes, and more importantly, the things that C15 does do. Its core role is keep our cells strong to defend against premature loss, specifically this ferroptosis.
Ooh, fascinating. And yeah, there's many types of cell death, right? There's pyroptosis, we've talked about ferroptosis, but to have this be, and we know that too much iron, right, can be dangerous, especially like you said, maybe in light of C15 deficiency. So Dr. Anthony Herbert has a theory called the pacemaker theory, and he's a zoologist, and he studied animals and found that the higher their rate of their metabolism, like the shorter their lives, and these larger mammals with a slower metabolism and maybe more saturated fatty acids within their cell membrane, maybe that is one reason they're living longer. But I always thought, and I want you to teach me here, that the portion of saturated fats and polyunsaturated fats in membranes was kind of consistent. Is it not? Is it that saturated fatty acids can come take the place of polyunsaturated fatty acids and kind of change that ratio? Is that what's happening?
That is what's happening. So we absolutely are what we eat. So
Yeah.
when it comes, especially when it comes to our cell membranes, it is remarkable, Autumn, of studies that have shown where they take a population of healthy people and they'll put them on high fat diet, low fat diet, and they'll measure the fatty acid makeup of the cell membrane even just over like a 12-week period.
Mm.
And they'll show that you shifts in the fatty acids in our cell membrane are shifted to reflect the fatty acids that we're eating.
Yeah.
So absolutely change it. So now we know that we need about, so it's not a lot. So think about cell membranes have lots of fatty acids. C15 serves as bricks that help
Mhm.
stabilize that cell membrane, but you don't need, it doesn't need to be, shouldn't be all bricks,
Right.
right? So you need just enough, but you need to have at least 0.2% of the fatty acids in your cell membrane or 5 micrograms per mil needs to be C15. And if you're below that, that's where the cellular fragility kicks in. And for the dolphins, we saw an absolute threshold where once they got up and over that level, cells were stable. When they were below, then they were at risk of having this deficiency syndrome. We're
Mm.
seeing this, yeah, saw the same thing in a randomized clinical trial with C15 supplementation in young people that had high liver enzymes. And what that study showed was that when they took C15 supplementation and if they got up and over that exact same threshold as in the dolphins, then we saw not only increased hemoglobin, so signs of increased red blood cell health, but the liver enzymes came down
Mm.
significantly. So there's all the support that, we moved away from all foods that have saturated fats,
Yeah.
decreased our C15 levels, and now the normal C15 level is 0.2%, right at that threshold of being, susceptible or not. So we're a very fragile society. And again, this is based upon lots of studies, meta-analyses, like prospective cohort meta-analyses in which there are now multiple versions of those. So really robust studies in humans showing that, we really do need to have not just association, but evidence of causation that
Yeah.
C15 is needed.
I'm so excited, and I want to talk about those human trials. But
Yeah.
first, I kind of want you to tell me, do you know offhand, is what are the fatty acids that are taking the place of C15? Like, are seed oils, do you believe too many omega 6s? Do you think this is a problem? Or is it like any saturated or fatty acid takes the place? Or can you tell me, do you know that?
I think it's, I think we are going to come at that there's a balance and that there are, just like we learned that not all saturated fats are created equally. We already knew not all fats were created equally, and then now we're like, not all saturated fats are created equally. The same thing holds for polyunsaturated fats, that there are, some that are pro-inflammatory, others that are anti-inflammatory. And so when it comes to the double bond component, so talking with Dr. Holbert, right, it's going to be fascinating. But just by decreasing the number of double bonds of fatty acids in that structure, is helps to stabilize it against lipid peroxidation, resulting in longer lifespan. So the goal is a theory, a hypothesis is if we overfeed ourselves with high amounts of double bond, fatty acids, of polyunsaturated fatty acids, without having adequate saturated fats, right, that help stabilize the cell membrane, we could throw off that balance. We also know that as we get older, our cells become more susceptible to attack by oxygen. And it's not necessarily because we have higher amounts of polyunsaturated fatty acids. it does appear that there's just, for whatever reason, an increased susceptibility of our cells as we
Mm.
get older to this oxidation. So as we get older, there's a need to really extra fortify those cells against that lipid peroxidation.
That's amazing. And Dr. Holbert has taught me that there's enzymes, the acetyltransferase, they can't tell which kind of PUFA they're putting in the membranes. So whether it's omega-3 and omega-6s, my hunch is that it's different based on which one it is, which one is accompanying those C15 molecules. But I'm going to ask Dr. Holbert. Now, my symptoms for people listening, like, well, how would I know if I'm deficient? I'd imagine from what you've told me, maybe iron dysregulation issues, maybe your insulin resistance. Before I want you to break down those human trials, what are some signs or symptoms that people could go, oh, this could be happening, other than I don't consume full fat dairy, other than consumptive signs?
Right. The best way is through blood tests. So your
Okay.
standard, the good thing is it's for the most part standard CBC and chemistries that you get when you go to your doctor. Increasingly there are fatty acid panels that include C15 in them, which is
Nice.
great. So you can actually get a C15 measurement. So that is helping a lot as we talk to, physicians, more and more physicians who are using fatty acid panels that include C15. They're going back at them and they're so surprised by how many people have low C15 levels.
Wow.
So they've been collecting it, but they didn't know to pay attention and look at it. Aside from that, because that's still not a common measurement, is again, kind of looking at the furthest down the pathophysiology, right, is elevated liver enzymes, insulin resistance, high elevated glucose. Those are caused by many things, not just C15, right? So that's not telling you, aha, you have C15 deficiency. So if you move further up in the earlier stages, it really gets down to those red blood cell indices. So
Mm,
if you have declining hemoglobin over time with increasing red blood cell distribution width, then
mm,
that is indicative of fragile red blood cells. And those are routinely collected with RBC indices. And then also, evidence of increased lipid peroxidation. A lot of these functional medicine panels are measuring lipid peroxidation levels. And then ferritin. If you have hyperferritinemia, a lot of times doctors look at that and they think it's an indicator of increased inflammation. It's also an indicator of too much iron in the tissues. So those pieces, if you have um, lower, declining hemoglobin, increasing RDW plus hyperferritinemia, and then whether or not you're at that stage where then it's advancing to the liver and metabolic conditions, that package is it's basically that is what we saw in the Dolphins because they only had one. They didn't have multiple phenotypes of a fatty liver disease, and it was just one thing, which made it so much easier to figure out the C15 deficiency component.
Beautiful. Thank you for laying that out that profile. And I remember being like kind of struck by that red blood cell width distribution. Can you tell people, just so that it like sticks with them, what is that measuring? Like, what is that an indicator? What's happening with that? Just so people can remember that.
Yeah, absolutely. So RDW is a measurement of how variable the size of your red blood cells are. So it's basically saying if there's a lot of variability, you've got a lot of little ones and middle sized ones and big sized ones. If they're highly variable, that means that your red blood cells are fragile and they're getting destroyed faster than they should, which results in that now you have to now make a bunch of new ones, and that's resulting in a lot of variation in the sizes of your red blood cells. So RDW is a measure of that. The higher, the more variable the sizes of your red blood cell, the less stable they are. There's a gold standard measurement of biological aging, and it's called Age Excel Pheno, and that was introduced by Levine, but now it's being used pretty routinely as a measure of how old are you biologically versus chronologically. And our goal, right, is to have a younger biological age than our chronological age. They came up with 9 different indices of a routine CBC and Chem that calculates your biological age. High RDW was of the 9 was the strongest predictor
Hmm.
of in accelerated biological age. So it's really important. The Dolphins were teaching us that, but now we're seeing that translate to people and across many, many studies now. You're more likely to be fragile and frail. A study just came out a couple weeks ago showing that the higher your RDW, the lower your hemoglobin, the more likely you are to be frail, to be, what's called a low functioning physical person, individual. And these are looking at people who are in their mid 70s. I mean, that's what we're most afraid of, right? Is frailty as we get older. So this showed that people in their mid 70s who had uh, higher hemoglobin, lower RDW, were associated with high functioning
Mm.
people in their mid 70s. And that's what we all want.
That's incredible. And C15 deficiency could be one thing kind of driving that. Oh, that's great. Thank you for that. Now let's get into that human research because you said you're keep alluding to this body of research. So I want to talk about your study. Talk about the study done by the independent group. Like what are you finding when you come in and correct that deficiency? And talk about other studies you love too.
Yeah, absolutely. So the nice thing about when you're talking about a nutrient, right, like C15, like omega 3s, if it's a nutrient, its goal is to support healthy growth and development when we're young and to help maintain our health throughout the rest of our lives. There is no single randomized clinical trial that is going to give you that answer because basically the RCT would either be withhold the nutrient from an infant and see
Yeah.
if they get sick. So that's right. It's not ethical.
No.
And the other is to say, okay, give them this C15 supplement, adults, over time and see whether or not they maintain their metabolic health throughout their lives, cardiometabolic health. So the amount of time in people makes it prohibitive. So for nutrients, the top way to get to a nutrient is what's called there's a group that Bloomberg et al. Of nutritionists that got together and they came up with criteria of how do you assess a foundational nutrient, and it was a totality of data, and the list it's long on them. It's like 16 things, right? So it's tougher than an RCT because it has all these criteria, which includes evidence of nutritional deficiencies,
Mm.
right? And so if it's truly foundational, so we've talked about the deficiency from the ferroptosis and adult side of things. What's been really fascinating are the studies coming out around infants and babies that we now know, multiple studies showing that baby C15 intake is dependent upon mom's C15 levels, and mom's C15 levels are dependent upon how much C15 she eats.
Yeah.
So if mom is C15 deficient, her baby is getting milk, both in the womb and in through mother's milk, is getting less C15 than they should.
Mm.
The more C15 baby gets from mom, the better their body growth, the better their
Mm.
head circumference. And
Mm.
now a study, the Eden cohort in France showed that the better their cognitive development, including language skills and overall cognitive scores up to 3 and 6 year olds.
Wow.
So, right, huge. So those are associations studies, but just as importantly, the gold standard nutritional deficiency models, animal models, those have been done as well, where they repeated the work done by George and Mildred Burr in 29 and 1930, where they first identified, N omega 6 and N omega 3 as essential. That exact same study was repeated for C15, and
Wow.
they showed that C15 met the criteria of an essential fatty acid as well as linoleic acid.
Wow.
So, and that's been shown in three nutritional deficiency models now in piglets and nematodes and mice. So foundational, really, so those studies are really important that are paired with the human studies showing it's essential. Then if we talk about adults, there's large prospective cohort studies following tens of thousands of people over, anywhere ranging from 6 to 20 years. And these are important because you're looking at C15 levels at the beginning and you're looking at the outcome over time. And
Hmm.
what those studies are showing is that repeatedly and consistently, the higher the C15 level you have earlier, the lower the risk of developing cardiovascular disease, including coronary heart disease, including stroke, as well as developing type 2 diabetes.
Wow.
So a lot of people default and say, well, that's association, but there's what's called the Bradford Hill criteria, which were established, right, to say, gosh, not only is you have the timing of it, C15, higher C15, better outcome. We have biological plausibility. We know that C15 not only strengthens cells, but it activates AMPK, which is a main mechanism of metformin, which helps, it's the frontline drug for diabetes. So we know this is a mechanism for glucose control. We know that it's a JAK-STAT inhibitor of like calms inflammation, including around the vascular cells, which then protects cardiovascular health. So it's all these criteria. When you go down and you check all the boxes, the totality of data supporting that C15 is an essential foundational nutrient that we all need to maintain our health it's overwhelming, right? To where Nick Shork, the head of NIH's longevity consortium, he's seen every longevity compound under the sun, and Nick has come out and said, "I've seen no molecule that has more supportive data for its role in maintaining our long-term health, our longevity, than C15." Period.
Wow. Okay.
Yeah.
That right there, that is so huge. And so I'm wondering, what is the percent decrease in your risk of mortality? Like, what is the magnitude of the effect in these
Yeah, so the
studies?
mortality one, there haven't been a lot of studies looking at mortality.
Or
So
cardiovascular risk,
yeah, but
whatever.
cardiovascular, the latest study, these are giant studies, like studies of studies, right? So the latest one that came out from Shaver et al. This year in 2026 showed there was a 32% lower risk of developing type 2 diabetes for every 0.1% increase in
Mm,
C15. So again, that dose dependent again speaks to more of causation than association. For the cardiovascular disease, it's slightly lower, but it's more like 18 to 22% lower risk of developing cardiovascular disease for every standard deviation in C15 increase. So this is
mm.
actionable, right? That
Yeah.
this is something we could do. And we're seeing younger people developing coronary heart disease, developing type 2 diabetes. I mean, type 2 diabetes used to be you know, that called adult onset diabetes, and type 1 was juvenile. And now we're seeing kids getting type 2 diabetes. They're aging faster than they should. And we think a big part of it is we took saturated fats, all saturated fats away from this generation, you
Oh
know?
my gosh. And is more better? So every 0.1% increase, is there an upper threshold? Like where's ideal based on what
For
you're
the,
seeing?
yeah, for the cardiovascular and metabolic, for those long-term studies, Autumn, it doesn't, the benefit doesn't stop. So, it
Mm,
goes all the way up to what people reasonably have in their blood, which is most people have 0.2%, and those scales always go up to about 0.6%. So
okay.
as you go from zero point 0.2 to zero point 0.6, it's a linear, for both of them, it's a linear decline in the risk for both type 2 diabetes and heart disease as you go from that 0.2 to zero point 0.6, which is interesting because people in Sardinia, right, that in the blue zone, high longevity zone, their levels are zero point 0.4 to zero point 0.6
Okay.
percent CVD. So
Okay.
that's more the longevity, side of things.
And did you talk about the supplementation studies and the study that you did? Did
Oh
you?
yeah, so
Yeah.
right, good point. So then there have been 7 clinical trials with focusing on or that have C15 and what happens if you increase C15 levels. One of them that involved our specific supplement of fatty 15, right, is where young adults, and this was a clinical trial at the request of Dr. Jeff Schwimmer, who is the leader in pediatric fatty liver disease.
Mm,
And as Jeff had read our study, this was 10 years ago, he had read our study about fatty liver disease in dolphins and C15 deficiency possibly causing it. So he reached out to us and he said, gosh, if this plays out in humans, right, this is huge because fatty liver disease, non-alcoholic form, the first cases were identified by Mayo Clinic in 1980, and now it's present in 1 in 3 people globally.
wow.
So, right, this is like, where did it come from? Like, just like for apoptosis, where did it come from? All of a sudden, it's like, oh, if you look at when we started decreasing our intake of saturated fats, and you give enough time, right, for that to happen, just like what happened in dolphins is happening in people. So Jeff said, gosh, I would really like to do a randomized placebo-controlled clinical trial with fatty 15 and to see what we could do with young adults that, that have elevated liver enzymes and a history of fatty liver disease. So that's why we chose this population, was at a demand, right? So he led the study. It was independently led. He was free to do whatever he wanted with the results. We had no control of that at all. So the 18 to 24-year-olds got 200 milligrams of C15 per day. They were specifically chosen if they were avoiding whole dairy fat. He was biasing it toward people who would have low C15 levels.
Did you
Two
measure them, the baseline?
he did after they were brought onto the study. So it wasn't used as a criteria, but he was hedging his bets toward probably going to have lower C15 if they're employed. So, and to that point, so there were 30 people in the study, 20 of them had our definition of low C15 levels of that below that threshold that the Dolphins had told us, right? At this 5 micrograms per mil. So now we already had 2 out of 3, 2/3, 67% of this population had what we were defining as deficiency. So he had the group go on it. In the group that took the supplement, of those that achieved a C15 level above that threshold, which was half of them, then if they got above that threshold, that's where we saw the benefit of raised hemoglobin and lowered liver enzymes.
Wow.
So, right, which is, again, it was validating on so many different points. We do have a high prevalence of deficiency. We do have a threshold that we need to reach and get up and over. And if you do that, it has clinically meaningful benefits that fits the exact pathophysiology that we had identified in the dolphins. So very exciting. There have been other groups done. There's a clinical trial done in Singapore. They did 300 milligrams of pure C15, same ingredient, supplementation among adult women who are overweight and had fatty liver disease, and showed that above and beyond taking a low calorie diet that was Mediterranean aligned, which is already known to be helpful for this population, above and beyond that. So they were doing that, plus they gave them C15 supplementation.
Wow.
They showed that that group had lower LDL cholesterol and improved gut microbiome with regard of growth of Bifidobacterium adolescentis. So that was encouraging. And then 2 really robust clinical trials showing how much, with again the same ingredient, showing bioavailability. So reliably, if we take 100 milligrams of this pure C15, this is going to increase our levels by approximately 0.1%. So that had fed into, this is why we can try, as far as understanding dosing that's going to work for most people. And then there have been others with regard to, there's one that was a high C15 content supplement that showed skin improvement in collagen,
Wow.
increased water, increased moisture. So like, wow, that's fantastic. And then one more showing that as people went on to a higher, ate at least 4 servings of full fat dairy per day, that their C15 levels increased, and those increased C15 levels were then associated with improved vascular health, so decreased vascular stiffness. So they just keep coming out,
Oh
and
my
they're
God.
all encouraging.
That is so wonderful. And I'm sure that you received pushback, but this is not like you're just using one random trial that you funded and just like drawing all these crazy conclusions, as we've
Yeah.
stated. And I will put some of those studies up as you talk about them. I'm excited about Fatty 15, which is your supplement. We're going to talk about that in a second. But first, how would you eat if you wanted to increase your levels? We've talked a lot about milk, and maybe we'd
Yeah.
find some mullet fish and pinfish, but are there other fish? Are there other
Yeah.
things you're eating on a daily basis to keep your levels up?
Cheese has been one of the most reliable. I know, yay!
Yay for cheese! Yeah, I love
One
it.
of the most reliable. There was a study that came out in January. I think it was either December or January, and it showed, they didn't look at C15 levels, but they showed that the more cheese people ate specifically, and this was a huge study. I think there were like 17,000 people that were followed over 27 years. I might have those numbers reversed, in which they showed that the people who ate more cheese had a lower risk of developing dementia. It's interesting. I'm not linking that to C15, but it's interesting with regard to, it goes against everything, like it's like, oh, don't eat high fat foods because but it's just like, we can't ignore these huge studies that are really robust, done by independent third party groups. Like, you just can't ignore. We really need to look at the data, the totality of data, and individual fatty acids and different types of foods. So cheeses. So Sardinians, right, they have high C15 levels, and it's not because they're taking fatty 15. So, uh,
So they
so,
could.
so how do they do it? Right, that's the first question. So they have local sheep and goats. It's in a mountainous area. And so not only do we know that C15 levels in dairy products get higher if they eat grass versus corn, it gets even higher if they eat high altitude grass, which is like,
Wow. Yeah.
what? And there have been two or three studies by different teams on this topic, which is fascinating.
Oh, I got to tell you, when I did my dissertation, you find out like the season the grass is grown, the
Yeah,
stage of growth, the grass versus the leaf. Like there is such incredible nuance to, and there's thousands, like in beef, there was 30,000 compounds, 30,000 that changed dramatically. So no, I love this. We just need to go to our local grocery store, find a high altitude and pasture raised cheese. Okay,
yeah,
check. That's awesome.
yeah. And beware, there are some products, there are some supplements that claim to be, we were laughing when we saw it, when we first saw it. It's like C15 supplement from high altitude grass-fed sheep. And
Yes.
Anna were like, well, clearly they listened to a podcast. And we went and we tested it for C15, and they didn't have any C15 in it at all.
Oh my gosh, isn't that
So
crazy?
just,
People are
you know,
wild.
be careful, be
Yeah.
careful. And so the cheese that is most accessible to us that the Sardinians eat is Pecorino.
Mm,
And Pecorino is like 50% higher C15 compared to other cheeses.
nice.
So I love my cheeses. Another way is fiber. So if we
Oh,
eat fiber, it can, there's a study that was done by Way et al. That showed, and these are mouse studies, so they haven't been done in people, but the question was, how does fiber help with liver health in mouse models of fatty liver disease? And what they showed was that when the mouse ate the fiber, the inulin in fiber was then used by microbes in the gut to make C15, and it was
mm,
that produced C15 that caused the liver health benefits. So
ooh.
our bodies can make some levels of it can use some different sources of fuel to make C15, not enough to get up and over that threshold, but every amount counts.
Yeah.
And then exercise, because you can't have a health podcast. But
Exercise increases C15?
yeah. Yeah. And and
Wow.
the belief is it's because if we're eating enough C15, we have C15 stored in our tissues. And as we exercise, it's helping to release the C15 from the tissues, get it in circulation, and allow us to do its job. So, yeah, like those, every little bit counts. So
Ah.
that combination that's what I do. I do that combination. And then, of course, I supplement. And that gets me into the Sardinian zone. So I'm at 0.56.
Oh, I love that you've measured. I'm gonna go measure. And I
Yeah.
love this is, and we're gonna talk about fatty 15, but I just want to say when I was pregnant, my husband would be so grossed out because I just crave cheese, just cheese, and I would eat it as a block. And he was like, stop with that. And so, and even people, I think it was Sylvan Lee Weinberg who admitted, and I think he was a president of the American College of Cardiology, that these low-fat guidelines have contributed to widespread metabolic issues, maybe related to C15 deficiency, maybe also related to what we're replacing these fats with, refined carbohydrates. And so I think I'm so glad your research is so important. I'm wondering when it becomes official that you've discovered this essential nutrient, like what needs to happen in order for us to just celebrate that already.
Yeah, so we've already surpassed where George and Mildred were in
Yeah.
1929, but it's okay. We have an appropriately skeptical world that has access to a lot of
Yeah.
science, and that's a good thing, right? We
Yeah.
welcome skepticism. And so the way it plays out is, you share your scientific data, you publish it in the peer-reviewed literature, and you put your stake in the ground. And we did that in 2020. And our senior author on that was Dr. Ed Dennis, who is a leader in fatty acids. He was the editor for the Journal of Lipid Research for 15 years. So, and it was Ed who's like, hey, this is meeting the criteria of an essential fatty acid. So we published that paper, and then you wait and you
Yeah.
say, okay, well, let other people work on it. So what's happened since then is now there are 3 or 4 teams now who have taken their own independent look of, it does C15 meet the criteria of essentiality. A lot of them are those hallmark gold standard studies I talked about, repeating the Georgia Mildred Burr study. So that was Szylski et al., and they published that work.
Mm.
They did an independent review of the literature for on the adult side and said that there's data supporting that this is essential. There was Dornan et al. From Canada, where they did their own independent analysis, and they titled their paper that odd chain fatty acids, including C15, are essential for our diet. So and then it's all of these pieces coming out from, again, like I shared with regard to in the earliest stages and in infant health. So it's happening, and importantly, there have been no peer-reviewed studies disputing it. So it really
Nice.
needs to play out in
Yeah.
the peer-reviewed literature, but thus far, amazingly, it's all supportive of it being essential. So it's exciting to see that. And about one new paper on C15 is published per week
Wow.
around the world. Yeah, so it's world's paying attention.
Well, congratulations. I mean, I just can't even imagine what that must feel like to have brought something like this to the world, right? I just think it's so important. You're going to save and improve the quality of so many lives. And we didn't even talk about it, but it's like it's helping with many hallmarks of aging. So tell us, if you want to touch on that, but what about C15? What is it made from? Where do we get it? And who should be taking it?
Yeah, so for Fatty 15,
Or Fatty 15, thank you,
yeah,
sorry.
yeah, that's what the Navy, they funded us to develop a pure C15 supplement
Nice.
for the Dolphins. We're
You're
we're
going to
like,
share with humans.
yeah, yeah, we're always like, no humans were harmed in the making of this dolphin supplement. So,
I love it. I love
so,
it.
so because they were having a hard time finding fish that had enough C15 in it. So they said, gosh, we will fund you to develop a pure C15 supplement for the dolphins. Ended up even more important for us humans, which is great. So we're in San Diego, so we're in a heavy biotech hub, right? And
Yeah,
so our approach was very pharmaceutical. So it was about how do we provide the same pure C15 ingredient that's used in all of the studies, and that you can control for it and make sure that it's high quality, bioavailable, and pure. So and while we're at it, let's make it vegan, right?
ooh,
So that
interesting.
it could be available for all.
Hmm.
So we take a plant-based C14 and we add a carbon onto it to
Okay.
make it C15.
Which
So
plant? Like what kind of plant?
so C14 can come from a lot of different plants.
Okay.
The most common are like coconut and nutmeg
Oh, cool.
are the
Okay.
most, but it doesn't have any coconut, it doesn't have any nutmeg in it. It's like literally just that molecule, and the molecule is so simple that you can make it bioidentical to what's in nature and in the form which is free fatty acid, which is readily bioavailable. When it's in food, C15 is stuck onto complex lipids called triacylglycerides, and our gut has to use enzymes to pluck that C15 off in order to absorb it. So we're like, let's just bypass that and make it
Yeah.
already, bioavailable. So that's how we make it. And every batch is tested, all of our, third party tested for its purity. And again, all the studies I talked about, the experimental studies were done with this exact same ingredient, this exact same molecule. So that's why
Incredible.
we have a 95% monthly retention rate on,
Wow.
which is like unheard of in the supplement space.
Wow,
And
yeah.
it's because, thank you, Dolphins. Like it's work. People are seeing and feeling. 70% of our customers see or feel benefits within 16 weeks. It's intended for your long-term benefits or long-term health, but the fact that people are feeling it, they stay on it.
What are they feeling? What are they telling you they're feeling?
Yeah, so there are some delights and surprises at the Dolphins. Couldn't tell us on them. So when you get to 16 weeks, a lot of people will go to their doctor and they will see those blood changes, right? They'll see
Yeah.
like lower cholesterol and better, glucose control and things like that. So that's the most important thing. But then we were reliably getting reports of I'm sleeping better.
Mm.
I have a calmer mood, and I have better energy. And we're like, well, that's called the placebo effect. Telling people, and and then I was like, wait a second, I'm not waking up at 2 a.m. anymore.
Ah,
And then I was hearing my family in Colorado, by the way, kind of sharing similar stories. And so we have a formal survey that our customers fill out. So we have one now. Over 6,000 people have filled out the survey, and it's very reliably, it's these benefits that people are feeling. The science eventually caught up to understanding why that's happening. We now know that C15 also, in addition to these other mechanisms of action, it also inhibits two enzymes. One's called MALB, one is called FAAH. But the take home point is through these dose dependent mechanisms, it increases dopamine and endocannabinoid levels
Nice.
in our body, which then results in better sleep, calmer mood. And then there's also a metabolite when we eat C15. It makes a second molecule called pentadecanoyl carnitine. We published in 2022, which is the second ever discovered full acting endocannabinoid. So it fully activates our receptors in our brain and our body that, they aren't there for cannabis, though
Yeah.
cannabis activates them. They're there for this molecule. So really
Interesting.
excited. Yeah, so it's like, we call them delights and surprises.
It's amazing, right? Because when you're like relying on nature, it have all these different side benefits that I'm sure you'll just elucidate the longer you study this. I'm thrilled with this podcast. Thank you for all of your research and most of all, like your humility and your sincerity. Like you can just feel how authentic you are about how exciting this is and your just desire to help others. So will you tell everybody where they can get? I'll put a link to Fatty
Great.
15, and then I'm sure we'll have a code. And if people have questions, let us know where we can connect with you. And then also tell us if there's anything else you need to say to make this podcast feel complete. Now's your chance.
Well, incredibly grateful to the Dolphins, to the Navy, for giving us this gift to the world. We're happy to be the vehicle, the vessel to bring it to the world. This is truly, Autumn, like you said, this is truly a movement. We have an
Yeah.
opportunity to meaningfully improve public health, global health, and thanks for becoming part of that. Really, really appreciate it.
Yeah, thank you. It was such an important podcast, and I will be forever your cheerleader. So check it out in the link below, and thanks for everything you're doing.
Great. Thanks, Autumn. Bye.